If you're just joining the webinar, we're going to give it about a minute and then we'll get started. At any point during the webinar, you can add a question in the Q&A box and we will work on getting to those once we have finished with our general questions and presentation. All right, thanks for joining us. Welcome to Navigating Your Nursing Career in Pediatrics with Lurie Children's Hospital. I'm Emma, founder of Nurse Fern, and I will be your moderator today. If you are new to Incredible Health, it is a hiring platform for permanent staff jobs. Nurses get hired in 20 days or less and get the support of nurse advocates who are nurses like you that support you through the whole job search process. I'm here today with two nurses from Lurie Children's Hospital to discuss finding your career at the heart of care in pediatric nursing. Thanks for joining us, Lisa and V. I'm going to go ahead and start this off by having you introduce yourself, and we'll have Lisa go first.
Sure. My name is Lisa Crick, and I'm currently the program director for experienced nursing and for our fellowship program here at Lurie Children's Hospital. Before that, I worked for 30 years in a wide variety of roles in our neonatal intensive care unit at Lurie. And then before that, I briefly worked in a pediatric bone marrow transplant floor at University of Iowa.
That's awesome. I love that we have somebody who's been with Lurie for 30 years.
Yeah.
V, I'm going to have you go next.
Hi, everyone. I'm Videhi, or V, and I've been a resource team nurse at Lurie Children's for about a year now, and I have about 2 years of pediatric home health experience, and as well as a couple months in geriatric nursing home.
Oh, perfect. So you've transitioned from adult to pediatrics.
Correct.
I love that. And then I also want to know how the two of you know each other, because before we went live, we found out, but I want everybody else to know.
V, you can tell them.
So basically, I met Lisa last year around this time in our program, in the beginning of the program. And one thing that really stuck with me that she said was, don't let any opportunity pass you by, and continue to educate yourself and go after every opportunity. And honestly, that stuck with me, and hence why I'm here today.
Yeah, so V was in our fellowship program, which is kind of a subset of our experienced RN program. We found that a lot of the nurses we were hiring recently had either a lot of adult experience and no pediatrics, or a very small amount of pediatrics. And so we developed a program to really address their needs.
That's awesome. So I really appreciate that you helped me with my segue, Lisa.
You're welcome.
During our discussion today, we're going to talk about why our participants have chosen a career in pediatrics, what a day-to-day in the life of a pediatric nurse looks like, and then how adult nurses, not adult-aged nurses, but nurses who work with adults, can transition into the pediatric career. So I'm going to kick this off with a question, which is, why did you choose a career in pediatrics? And we're going to let Lisa take it first.
Okay. This, I think, is a hard question, because for me, there wasn't a different choice. I did work at a VA hospital in nursing school, and while that group of patients are amazing, I knew that that was not where I wanted to be. And then when I got into my pediatric rotation in college, I found my home. I was a little surprised. I landed in the NICU by accident, but long story short, I think pediatrics for me is just more fun. You get to paint fingernails and watch Little Mermaid, and you get to play at work. And the kids are so resilient and they amaze me every single day that I come to work. I just think that pediatrics is a lot of fun.
Ever since our practice session, it resonates when you were talking about how fun pediatrics is and the activities that are so different that you get to do with them compared to the adult population. Why did you choose a career in pediatrics?
Well, I always liked pediatric nursing, and after working with adults, I knew for sure that pediatric nursing was my calling. And there is like a wide, age group in pediatrics, anywhere from like a neonate to 18-year-old, and you just get all ages. And like Lisa said, you get to see the resilience, and that is absolutely amazing and so rewarding.
And I'm going to pick on you, V, because you mentioned the adult population a second ago. What does your day-to-day look like as a pediatric nurse compared to adult? What's different?
So at Lurie Children's, I'm in the resource team, which basically means that I float from floor to floor. And I can be in anywhere in our med surg floors, or I can be in ICUs. So I call in, they tell me where I should go depending on which floor needs us. From there on, we go to the floor. We have about 3 to 4 patients in like a regular floors, and in the ICUs about 1 to 2. And then from there on, we kind of do, just get a report and figure out the day plan. And then you get to see, you basically get to meet your little people and kind of plan your day according to that, how you're going to just go through the day and talk to them and at their developmental levels and all those stuff. So
what's the big difference that you see from adults working with adults to working with kids?
I think the biggest one is basically adults can tell you, what's going on with them, like what they're feeling, if they're hurt, what do they need. Children are, it's hard for them to communicate at times, according to, again, their developmental levels. And, if it's a toddler, they can't really, if it's like a little infant, they can't really speak. So you have to rely on nonverbal cues. And that you just develop through time. And that's how you learn. And, Lurie Children's teaches you that. And that's fantastic. And basically, that's, I think, for me, it has been the biggest difference. Otherwise, everything else is pretty much the same. All the other aspects of nursing, the procedures, the medication, the routes and all that stuff is pretty much generic.
What are some career challenges that you have faced as a pediatric nurse, or that you've also seen those in your cohort go through?
I would say it is a little difficult to see like children go through certain things. If you're in like I would say our hemonc floor and you see a little toddler or a little child battle through cancer, and it kind of it's a little difficult, and it requires a lot of compassion and a lot of empathy, and it's emotionally a little taxing. However, like the other side of it, seeing the resilience of the family, of the child, you go, what, if they can do it, I can do it. And I can work with that, and I can learn from that. And I think that's pretty amazing to be a part of their journey. I think it's quite rewarding.
Lisa?
Yeah, I think V said it really well. One of our chaplains said that we work in a world of shouldn'ts. And I think that really resonated with me, that, pediatric kids shouldn't get cancer, kids shouldn't have genetic disorders, kids shouldn't have pain. And so although I love working with kids, there's a lot of times where you're thinking to yourself, this can't possibly be happening. And, it's always happens to the nicest family. And so we live in a world of shouldn't. And I don't know if this is a challenge in a bad way, but in a positive way. Pediatrics is a relatively new form of medicine, and so it is ever changing. I mentioned this before with you guys, is when I started in the 1900s, there was one ventilator. I think it had 5 buttons on it, and it was one mode of ventilation. And now there are 5 ventilators that we work with in pediatrics, and each one has multiple different modes of ventilation. So every day is a new adventure that you can continue to, you just keep growing and learning every single day. The amount that I've learned since I've been here is crazy to me. The things that we're doing now compared to the things that we were doing then, we can save so many more kids than we've ever been able to save before.
Really incredible what nurses do now and are a part of just because of the advancements.
Yeah.
And I know the answer to this, but I'm going to ask you anyways, because I want everybody else to know. But can adult nurses transition into pediatrics?
Well, I think V is a perfect example of the answer is yes. I think you can't really limit yourself if you feel like you're an adult nurse, but you maybe think you want to try the pediatric avenue. I think go for it. Like V said, there's a lot of similarities. Where there aren't similarities, we'll teach you the differences and you'll pick them up really quickly. But I think that it's just a different form of nursing. So if you were thinking I'm an adult cardiac nurse and I want to become an adult oncology nurse, and that doesn't seem unusual to you, then I would say also I want to become a pediatric nurse shouldn't seem unusual to you either. It's just a different specialty in nursing. We're all nurses. We all do amazing things and it's a good opportunity. But B, you can probably answer it better.
I personally think it's, again, because I always wanted to be a pediatric nurse, it was fairly easy for me to transition because you already have the skills down. You know how to give GT meds, you know how to put an NG down or whatever it is. All you need to do now is just learn how to communicate with the new population. And the parents at bedside are a great resource. They know their children. And I personally find that very comforting most times because they know their child and you have another set of hands there. And that's fantastic to have. So yeah, no, you can.
That actually brings up a really good point that one of the difference between adult and pediatrics is we are treating the whole family. And I know that you treat the whole family in adults as well, but typically it's the patient, as long as they have the wherewithal to do it, that's making a lot of the decisions. And in our world, the parents are ultimately making the decisions, but the patients are typically a big part of that once they're able to start thinking those kinds of things through. We have 10-year-olds thinking about whether or not they want to continue chemo, and we have kids in the PICU who are deciding whether they want to continue dialysis. And so we have to treat the whole family. We also know eventually we're going to send them home with really complicated medical technology that they're going to be dealing with at home. And they didn't get any nursing school the way that we did. So we have to do real crash courses in management of whatever is going on with their child so that they can take the best care possible at home. Because ultimately that's our objective, is to get them home as soon as possible.
And a moment ago, you two were both talking about the differences. And I know that as a nurse who takes care of adult patients, we know we could go to pediatrics, but I really like that you have a fellowship program. Can you do a quick overview of what day 1 through 7 looks like? Because I think I know how good your nurturing is, and I just want everybody else to know.
Yeah, we start the first couple of days are a lot of just what all your supports are, because nurses need a lot of support. We need social work, we need speech, we need child life. So we kind of introduce that, but then we move into more of the fellowship, and we want to recognize that people are bringing some experience with them. They're bringing prioritization and time management and all those awesome skills, but let's tweak it a little bit and put a pediatric focus on it. So the first day of our program is really dedicated to patients and their assessment. We do a little mini head to toe, reminding everybody of the differences between the two. We talk about a lot of our hospital acquired conditions and how they might look a little bit different in pediatrics. All the equipment we use, we know that you probably used a Foley someplace else. This is the one we have. Let's all look at it together. So it's just familiarizing them with the equipment, but then we really dive into the meat and potatoes of it, I think, where we move on to the next day. We focus on patient safety, and we actually do simulations with the fellows. I think some people think that simulations are scary. Hopefully V will say that they're not. They're very educational, but again, it's familiarizing everybody with what do we have. You're probably bringing a lot of experience to our hospital, and we want to show you the equipment that we use and how we use it, and how our flow of running a code, our flow of providing rapid dehydration support. And the afternoon of that, we do all things central line, everything you can possibly think of, because we, as a not-for-profit hospital, we want to make sure that we're using our money wisely. So if we know that prevention of eclampsia means that we can take care of more patients, that's what we want to do. That's our focus, is getting out into the community and taking care of as many patients as possible. And then the third day is all about them. So we start the day talking about how they continue to grow as a professional within our four walls, and maybe even outside of our four walls by continuing their education. We talk about making that transition. We know that probably where they're coming from, they were precepting, they were in charge, they were the it girl or boy, and now they come to us, and now they're back at the bottom again, and they're learning everything, and it feels weird again. So we kind of explore those emotions with them as well. And then, and there's a couple other things in there. And then in the afternoon, we really talk about wellness and taking care of themselves. Lurie can be a pretty intense place. We have a lot of really medically complicated patients, and we want to recognize that they need care just as well. That whole thing when you get in the airplane and you have to put your oxygen mask on before you take care of anybody else. So we know that we have to take care of our nurses first, so that they're able to then show up every day and take really good care of our patients.
I don't know why this didn't hit me before when I first heard you talk about it, but I love the focus on the patient and patient care, but also equal focus on the nurse as a person and supporting them. I think that's something truly special that you offer. I don't think at any of the leading institutions I've ever worked at, that's been something that they've really put together for us. So I think that's really cool.
Oh, yeah, yes.
Can you, and I know this is a question that I get a lot when talking about nurses transitioning into different areas, but are there specific adult specialties that translate really well into peds? Can you share a little bit about that?
I think that's such an interesting question. I have seen adult cardiac nurses come and join our CCU, and I'm kind of blown away about how different it is, because we take care of congenital heart defects. We're not taking care of heart attacks and valve prolapse and stuff like that. So it is a whole different ball of wax. I would just say, don't even worry about that. Don't limit yourself to what you did before. If it applies, that's great. If it doesn't, we'll teach you everything else once you get here. It is a little bit different, and we don't want anybody to feel like they made a choice and they have to stick with that forever. We've had so many nurses come to us from oncology and go to the NICU, and it's a whole different world. We've had nurses come to us from the NICU and go to the OR, and it's a whole different world, and they're successful. So I think there probably is a little bit that transfers, but I think, like V said, it's a lot more about the skill set is what transfers. The rest of it, I wouldn't even worry about. I wouldn't put a limit on what you think you can move into based on what your past is. Go for it.
What are your thoughts on a nurse who is a little apprehensive to leave what they're really comfortable with, and they have a big fear that they really want to try peds, but what if they don't like it?
I think V, you can remind me if I said this in yours, but I usually say, like, when you're going from adult to pediatrics, we realize that you're literally taking a dart and throwing it at a dartboard. And you may not hit the bullseye the first time. So we encourage our nurses to get here, get in your job for 6 months and give it a shot. Give it your all for 6 months. And if you don't like it, speak with your leadership team, and maybe we can find something that's a little bit different that will meet all those needs for you. We really want everybody to be happy about coming to work. We don't want anybody sad and feeling like they're stuck in a position they don't want to be in. So we would rather move them into a different place within our hospital than to lose them as an employee.
Absolutely love that openness that everybody, like, it's like the undercurrent that everybody knows is going on, but most places don't admit to it, that you are trying something new, and let's keep trying until we get it right. I think that support is important. So we get a lot of questions about ways to advance your career in nursing. What are some tips or advice you would give to nurses? When Lisa goes first again.
I'll go first again.
Let you drink some water.
Wait, did you say I go first?
Yes.
Okay. Boy, I think that nursing is such a great profession, right? We can start at the bedside and then you can continue to grow at the bedside. We have nurses in our hospital who start with PIVs and then they learn ultrasound guided PIVs, and then we have other nurses that learn how to put central lines in at the bedside. So I think we have a lot of opportunities that even if you're not somebody who's thinking I want to go back to school, or maybe you're at the phase in your life where you have little kids at home and it's just not a good time for you to go back to school, there are plenty of opportunities to grow at the bedside. And then also we have a huge clinical governance model with I always think it's like a really big high school that has like every club that you could possibly think of joining, and there's got to be a club that you could join. We have so many different committees. Our chief nursing officer actually started as a bedside nurse within our hospital and worked his way up to where he is today. But he emphatically believes that the nurses that are the decisions that are affecting the nurses should be made by the nurses. So he very much supports our clinical governance structure. You get off unit time in order to participate out of your FTE, so you're not working, tons above your hours. But then even if thinking about how can I advance at the bedside, but more on a professional level, we support getting certifications. I have a lot of certifications, so I have a lot of letters. If you get a lot of letters, then your last name is really small on your ID. And you can also do continuing education through tuition reimbursement, which is something I did. I ended up getting my master's degree at 50. I'm not sure that that was a great choice, but I did it anyway. And I think there's lots of opportunities to grow in the hospital. We also feel like we have so many new grads coming in right away talking about becoming a nurse practitioner, which I think is great. And we love to grow our own nurse practitioners. So there are a lot of former Lurie bedside nurses who are now APPs within our hospital. But we also think that maybe there isn't as much information for them about all the other things. We have clinical quality nurses, we have safety nurses, we have nurses who work in our clinical governance or clinical excellence. We have nurses who do research, who do data collection with our physicians, work in our clinics. So there's lots of opportunities, I think, to continue to grow. It just depends on what is your avenue, what kinds of things do you like to do. And that's where we really work with our unit-based leadership teams to find those opportunities for each nurse.
I love that you expose nurses to all those other opportunities, because in nursing school, we don't really know about that. So obviously the career we see is nurse to NP to like it's either leadership or NP. And the fact that you openly like cultivate your crew to go that direction is incredible. Do you have any tips for us?
Of course, I think building off of what Lisa said, continue your education and acquiring the new skills. So being in the resource team at Lurie Children's, not only, like I said before, I get to be on the floors and ICUs, I can also choose to go into like other departments of the hospital later on in my career, where I can go to the ED or the PACU or the psych units. Basically, like Lisa said, the sky's your limit at the hospital, to be honest. There are so many different opportunities that you can learn about, and you can ask your leadership and they will help you, because they are like, everyone is amazing at helping you find your niche. And I remember Lisa saying that in the beginning of like our fellowship programs, like we will find a place for you, we will help you grow, and we will make sure that you're comfortable here and you're being successful and you love being part of this great organization. Another thing, like Lisa mentioned, was the governance committee. I am part of the nursing research committee. I just joined it. So basically we do some research, and there are other committees like the infection control or a care club. which they organize like fun activities, and you can be part of that, and help the whole, like, build up the resilience in your teams and everything like that. So there are a lot of opportunities. Just ask questions, and you'll find a place for you.
And I may have fully missed this while we were first talking, but did you go directly into the resource team when you started there?
Yes.
Okay, very cool. So you
Yeah.
get to do everything.
For sure. I think I got really lucky when I did apply to that, and I got accepted, which honestly, I knew about the concept about resource teams or like float teams at different hospitals, but I was under the impression that they only accept experienced nurses. And when I did get accepted, I was like, yes, because they didn't need that experience. And if you had a little bit of experience, that's great. If you didn't, that was great too. And yeah, so if that's your thing, then you should do it.
Did you know when you applied where you were going to end up, or did you just know you were doing the fellowship and then you were going to find a home from there?
I did know that I was going to be in the resource team. Yeah.
Okay, very cool. I mean, I might become a pediatric nurse after this. Who knows?
You're more than welcome. It's a fun world.
Chicago seems a little cool. So I just want to give a quick reminder to anybody who is watching the webinar right now to please drop any questions you have in the Q&A. We are approaching the section where we're going to start pulling those, and all right. So let's give our last question for you. We hit it already. So I'm going to launch into, I want some encouragement. So if there's one message or word of encouragement you need to leave nurses with, what would it be? And Lisa, I'll let you go first.
Oh, I keep having to go first. I always I always tell everybody really to be open to opportunities. So here's V here. She actually listened. Be open to opportunities. I've rarely said no to things. I think a lot of times you're nervous about trying something, but the only way you're truly going to find out if it's a good fit is if you give it a shot. I also think listen to people who know you really well, because they may see something in you that you don't even see in yourself. A couple of the positions that I've had, I don't even think I said I've been a manager. I've done a million things. But a couple of positions I've had, I didn't even think I would be good for, and somebody else saw it in me, and it led me to the path where I'm at today. So, and then the other thing that I think is the best advice anybody ever gave me was to make sure that your resume makes you the obvious choice. So if you're thinking, so for me, to get in a role that I'm in education, starting on your unit in either the parent education committee or the staff education committee, and finding those opportunities. If they're looking for people to help support our nursing residency program, volunteer for those. It'll get you in, so that then just keep taking those opportunities that will lead you up to it, so that when you apply, they're like, look at all this wealth of experience they have. If you're thinking about leadership, find opportunities to lead on your unit, become a charge nurse, be on a committee, and then become the chair of the committee because you're leading that group. So think about what your end game is. Even if your end game is 10, 15 years from now, what can I do today so that that will be achievable later on?
That was really good advice. Hey, can you top her?
Probably not, because I have followed her advice.
Protege.
For sure. But I would say, most of us are drawn to nursing to help and care for others. And I feel like as a pediatric nurse, not only will you get the opportunity to influence various aspects of our patients' lives, like, social, emotional, developmental, physical, cognitive, spiritual at times too. But you do that at a really young age. So when we think about, like, being the village for that child and many, many children, I think that's fantastic. And then you get to see just like the tremendous amount of resilience in this population, which I cannot stress enough is, you think, oh my gosh, it's a NICU baby, it's so fragile. No, they have been through so much that, none of us can imagine. And they are just amazingly resilient. The families, the patients, fantastic. Yeah.
I love that. I cannot say enough that I really see a difference with the positivity that the two of you speak about with working with patients, even if it is that you live in a world of shouldn'ts, that they shouldn't actually be as positive and resilient as they are. And that has really been impressed upon me during this discussion. We have about 10 minutes left, so we're going to go into our Q&A section. If you have a question for the panelists, please feel free to drop it in the Q&A, and I'm going to go ahead and get started. I have a question that came in from one of our other social media sources first, and Lisa, surprise, you're listed to give advice first. Any advice or heads up for a nursing student planning to go into pediatrics?
Oh, try to get it. It depends on the person. If you have the ability, try to apply for a student nurse position. You won't be doing as much, but you get to see it all. And I really think that helps decrease the amount of anxiety you have when you first start. The people who transition from a student nurse or even a certified nursing assistant role and then take on the role of a new grad, they have a lot less anxiety. Other than that, look for opportunities. I don't want to like advertise, but we do have a student nurse conference coming up that we try to talk through people how to make the transition from what it looks like in a book to what it looks like in real life, because trust me, it's a lot different. And I would just say try to seek opportunities that will get you more face time with those types of patients. I can't think of a different way to say that.
I'm going to piggyback a question from the chat onto this, and it's from Monica, and it says, I'm an ABSN student being faced to make a decision about where to be placed for a preceptorship. Coming into nursing school, I always thought peds is where I wanted to go. However, having worked with adults during my rotations, I'm not so sure. Unfortunately, I won't be able to have experience in peds for rotations until after I've chosen my preceptorship. What would your advice be? Choose a peds preceptorship or start in adult care and move to peds?
Well, go ahead, V. Yeah.
I was in the same boat where I did get my preceptorship in adults. And if you wanted to do peds, I would say, in nursing school, we get a lot of hands-on experience with peds, with adults. But if you can get the opportunity to, have some pediatric experience, by all means, do that, because that will tell you, and you would actually end up making the decision that, yes, this is the world for me, or it isn't, because there are way more adult opportunities than there are pediatric nursing opportunities. So you can always find more adult experience. However, pediatrics might not be as easily available.
That is so true. And I've never seen a manager in an adult environment hold it against a new nurse that they had a peds preceptorship.
Yeah.
Let's see. Ooh, this is a fun one. And whoever goes first gets it. What has been your biggest moment working at Lurie?
I'll go.
Lisa has to work through the card catalog of the last 30 years, so we'll let you go first, V.
Honestly, I think for me, they've been very generic, that when you go into a shift and you do not have this, because you're meeting this little person for the first time, and it's hard to bring that rapport and like kind of have them trust you, which is one of the biggest things in pediatrics, that you have to like build in the trust, and you have 12 hours to do that, and usually, thank goodness, I've been able to get through that in 4 hours. You kind of build that relationship so the entire shift can be very smooth. And the other day I had an infant who did not sleep the night before because she was very uncomfortable wearing this little nasal mask and whatnot. And the mom had to stay up all night. The next day I came in, I was like, you know what? No, I'm going to do this. And I basically held her little hand, and she had, her little tiny hand wrapped around my finger and my hand, like my finger, yes, because her hand was very tiny. And she slept, and I was able to comfort her and have her get some rest, which she really, really needed. And for me, I think that's just like great moments like that. It's just fantastic.
Well, I will probably cry. This is, I can think of a lot of scenarios, but there was one patient who came in the middle of the night and he was really, really, really sick. And he was so sick that his mom didn't even get to see him. We just took him. He was a crash C-section, so she didn't get to wake up and see him. So she had never seen him. And he came to us and once he got to us, we found he was not a candidate for ECMO, which at that point in time was the big guns. That's all we had. And he wasn't, because he had bilateral hypoplastic lungs and he also had a mass on his liver. And so they felt like he wasn't survivable. He wouldn't survive ECMO. It wasn't going to help him. So we didn't put him on ECMO, but we did put 5 chest tubes in him. And we would tilt him every day and take an x-ray to see where the air was. And then we would try and tilt him to get the air to go to one of the 5 chest tubes. And to watch that mom sit there, we have a rule that you can't hold the kids until the last chest tube's out. And so to watch that mom sit there for 3 months, this is where I'm going to cry, to watch that mom for 3 months. But then it was the last tube came out and they waited for me to get there. I was a night nurse and I walked in and the mom's like, today. And I said, today. And I got to, sorry. I got to hand a baby. I got to hand a baby to the mom for the first time when she'd sat there thinking he was going to die for 3 months. And that was like the best. And it was wonderful. Okay. Talk about something else.
I can't even, I have no story like that in the world. I imagine how incredible that is. Okay, we're not gonna be able to top that, but I'm gonna throw another question out there so we can clear these eyeballs. I can imagine working with children is fun. However, what is it like having to interact with the parents? And you've shared a few stories, but I know this is a general fear or just apprehension of moving from adult to peds.
I would say for sure there is, a very popular notion that yes, dealing the pediatrics is fine, but dealing with parents is very difficult. But I also think that stems from the whole idea that parents are very concerned about their child. I'm not a parent. I can never understand what it's like to have a child being so sick. So when I interact with our parents, what we are taught to do and what we generally do is we communicate and be very honest with them about what we're going to be doing, what the plan is. This is what the plan is for the next 3 days or until discharge or whatever it is. This is what I'm going to be doing during the night, and they understand. And mostly everyone is very accepting of that, and everyone is very understanding that this is needed for the child to be better and feel better and hopefully eventually go home very soon. So yeah, just open communication, I think, works everywhere pretty much. So just do that and you are destined to be successful.
Love it. We're running short on time, so I want to jump to the next question, and I'm going to send it to Lisa because it piggybacks on the resume stuff you were talking about. But what are some qualities or skills that are often looked for as a pediatric in nursing applicants?
We always joke that you can say you worked at Target as long as you can make it relevant to the unit that you're going to be working in. We look for people who have good communication skills because, like Vee was just saying, not only do you have to communicate really well with the patients, you have to communicate really well with the families. We like a very diverse group of nurses, so it's really hard to say who we look for. We don't look for a certain person because we know we're dealing with just as many different types of families as there are different types of nurses, and not every nurse is going to mesh with every single patient. So we need the nurses who are really good at dealing with difficult families. We need the nurses who are really good at skills. We need the nurses who really love research like Vee. We need all of it. So I think as long as you can bring something to the table that when you are interviewing with that unit, they can see how you will fit in their puzzle, like how you will complete something for them. So putting on there whatever it is that you think that you're really good at, and then in your interview talking about how you think that would apply to the unit. What my biggest piece of advice would be, do your homework. one of the things, it doesn't really matter what's on your resume, but if you get an interview and you walk in not knowing anything about the unit you're applying to or anything about the hospital, we really need people who want to work here because it can be hard sometimes. We see some pretty medically complicated patients. And so we really want people that have thought this through and think that they'd be a good fit for us. I'm not sure if that answered the question or not, but that would be my best piece of advice is just make whatever it is that you're really good at applicable to the unit that you're applying for.
I think that's a perfect answer because everybody has to start somewhere. So share what you have and then translate it to where you want to be.
Ooh, can I add something to that? I would like to take a quote from Harry Potter, is that every single nurse who's at a great position started right where we are as students. So if they can do it, why not us?
I love that. And I think that is the perfect advice to end on. If we didn't get to your Q&A, Incredible Health will work on getting to those in social media in the next few days or weeks. And I just want to say thanks for joining us on Navigating Your Nursing Career with Incredible Health and Lurie Children's Hospital. The big takeaway today is that you should never limit yourself based on your past experience or your location. If you are interested in exploring what your career has for you, I recommend creating a profile on Incredible Health so that you can find a staff job that supports your career goals. This is the really exciting part. Lurie's offers relocation packages, tuition reimbursement, and benefits, and so much more. Sign up on Incredible Health, and we will help you find your dream role.